Mr. President, I thank my friends who've been here talking about this. Both Senator Thune and Senator Barrasso have spent so much time on figuring out ways that this could work better, and obviously it's not working as well as people hoped it would. I mean, there's a series of headlines I saw on my desk today. CNN Money said, were Obamacare applications accurate? Who knows? Reuters says Obamacare exchange is not properly verifying applicant data. The New York Post, Obamacare data errors could jeopardize coverage for millions. The Washington Times, Obamacare market foul up eligibility and verification in applications. The New York Times, eligibility for health insurance was not properly checked, audit finds. The Wall Street Journal, report false controls of health exchanges. This is just simply not working. It's not like there wasn't a lot of time to make it work either. It was from early in 2010 until the law was implemented in the end of 2013, and just one problem after another, which is a good indication of what happens when the government tries to do more than the government's capable of doing. When the government tries to prescribe all kinds of decisions that would be so much better left to individuals, as long as the government's done what it could to ensure a more aggressive, active, competitive marketplace. But that's not what happened here. The Associated Press this weekend had a headline that read, Senate Democrats try to pull focus from Obamacare. Well, of course they would, because every Democrat who was in the Senate when this bill passed voted for the bill. You know, if there's one long-term political lesson to learn here, Mr. President, surely it is that when you do something this big, you should do it in a way that no matter what you have to do to find a way to get people on both sides involved, don't do this in a way that shoves it down the throats of the country or your colleagues. More bad news, more broken promises, higher premiums. The anticipation this fall is that premiums, notices of which will go out later this year, are going to go up. They're going to go up in double digits. The promise in 2009, not only that families would pay less money, but they'd pay $2,500 less money. We were somehow, the people who were for this bill in the administration knew so much about health care and so much about the impact of what government having more control of people's health care would do, is that not only did they know the premiums were going to go down, they were going to go down $2,500 per family. Now, most families are finding that there's a $2,500 number, but it's the one you feel lucky if your insurance for your family just went up that much. July the 1st, the Health and Human Services Office of Inspector General released that report that was the subject of all those headlines I just read. The report that said, just didn't do enough to verify, haven't checked this closely enough, don't know if people are really eligible for the government assistance they're getting for their insurance or not. Said that the administration was unable to put safeguards in place to protect taxpayers and to prevent incorrect subsidy payments from happening. The report also found that the administration didn't even follow its own eligibility verification in many instances. They didn't go through the procedures they had set up for themselves, and in fact, of 2.9 million verification inconsistencies, they were unable to resolve 2.6 million of them. So they wind up with 2.9 million problems that they find out when they find their verification inconsistencies, and 2.6 million of the 2.9 million, hey, we just can't figure this out. We didn't get enough information. We don't know why the system's not working, but it's not. In January of 2014, the Secretary of Health and Human Services, Secretary Sebelius, certified to Congress that the Obamacare exchanges could verify that individuals receiving tax credits and cost-sharing assistance were actually eligible to receive taxpayer-provided assistance. Now, apparently by July of 2014, 6 months later, the people that checked to see if that was true or not find out it's not true at all. Middle-class Americans have enough pain with this law already without finding out that their tax dollars are going to pay bills of people who don't qualify to have that much of their bill paid, or maybe not even any of their bill paid. Recently, I spoke on the floor about a contract in Missouri and 3 other states with a British company, Serco, about the lack of transparency and accountability in the act. As the St. Louis Post-Dispatch recently reported, they said, quote, whistleblower allegations last month that claimed workers slept, read, or played games at Wentzville. This is the Wentzville facility, back to their quotes exactly. Played games at Wentzville invoked a flurry of questions from Missouri's congressional delegations. Further quotes in that story: we played Pictionary, we played 20 questions, we played Trivial Pursuit, one employee told the Post-Dispatch. She estimated that she'd processed 6 applications the entire month of December. CMS didn't acknowledge these allegations, but they said they'd adjusted Serco's work to accommodate changing operational needs. 2 months ago, Senator Alexander and I called these reports into question, and we sent a letter to CMS saying, what are you doing there? Why is this not working? Why would you, I don't know that we said it in the letter, but we could have said, why did you contract with a British company that already was in trouble with the British government for not providing these services? These are not particularly technical services that there's only one country in the world that could provide services to the United States, but we found the one place in the world where we found a company that was already in trouble with their own government for not providing services and said, you're the company for us. We want you to be the ones that provide these services for people who can't apply over the internet and send in their applications in some other way. And so Senator Alexander, I said, what about these charges that people just simply don't have anything to do? And rather than admit they have nothing to do, you say, well, here's library books stacked up on the table. Here's the Trivial Pursuit game. Touch your computer every once in a while, refresh your computer at least once every 10 minutes so it looks like you're doing something. And 2 weeks ago, we finally received a reply after 2 months of having this question out there. And I think I put that reply in the congressional record. It was so much of a non-answer answer. It was more like, we got your letter, we are going to look into this and see if we can figure out what's happening. Don't think it would be that hard to figure out. I recently learned that CMS determined that Serco had met the terms and conditions of the contract, which apparently involved, if you believe these employees, playing board games and reading library books. And CMS decided this British company had done such a great job, they were going to exercise the first option of the contract. And on June the 28th, they awarded an extended contract to the company through what they said was a full and open competition to provide these services. Mr. President, the lesson here is that the government needs to think long and hard before it gets into the world of making decisions for people that people can better make for themselves. The government doesn't need to think long and hard to believe that there is a government responsibility to ensure a certain amount of consumer protection, that what companies say they're going to do, they're required to do, that they clearly tell you what they're going to do. But the families can more often and better than the government decide what they want in their insurance policy than the government can decide what they want in their insurance policy. The stacks of letters that my guess is every member in the Senate got, and I know I got, about people who are retired who don't understand why they need pediatric dental care, about people who don't understand why they need policies that cover a half a dozen things that they couldn't ever possibly use, and who don't understand why now those policies are so expensive that they can no longer afford to have the policy that they had, who don't understand why cutting Medicare to start a new government program makes sense, because, Mr. President, it didn't make sense. And it doesn't make sense to cut a program that clearly is facing challenges as our society gets older, to cut funding for that program by $600 or $700 billion over 10 years, so you could start a new program that the costs are clearly going to be so much more than anybody anticipated. Pleased to join my friends today who've been here for several minutes now, the better part of this last hour, talking about the challenges we face. And we know that there are better solutions. More competition would have been one of those solutions. Buying across state lines would have been one of those solutions. Associated health plans, where you could take your small business or an individual, find some group to become part of, and the government could have made that easier instead of made it illegal and impossible. More transparency by providers. I'd like to know what hospitals and doctors charge and what their results are, and they know. There's no reason that that couldn't be made available to people. In fact, one of the better provisions in the Affordable Health Care Act says the government's supposed to do that, but of all the things the government could have done, that's something the government hasn't yet found time to do. Medical liability reform. There were a double handful, and maybe even just a single handful of things that we could have done to say, let's try these things and see if they don't make the system work better, and see what lesson we learn by injecting these 2 or 3 or 4 or 5 things into a healthcare system that was the best system in the world. It just didn't have the amount of competition, transparency, and access it needed to have. And so, Mr. President, I would continue to hope that we'll move forward, learn the hard-learned lessons of the implementation of this plan, and go back and find what was working so well and figure out what we needed to do to make that work even better, and I would yield the floor.